In healthcare, even the best treatment means little if patients choose not to follow it. And this is where study began. Good day, everyone. We are Group 4A of BN3A from the University of St. La Salle College of Nursing, and we will be presenting our study entitled Resistance in the Rounds, Nurses' Insights on Patient Noncompliance in Hospitals' Treatments and Procedures. I am RANIE Oliveros Jr., and I am here today with my fellow researchers, Amber Gabrielle T. PAMPLIEGA, RASHID P. PANOGALING, Robert Matthew Sipo, and RICA A. RESPICIO.
This study aimed to explore nurses' insights on patient noncompliance in hospital treatment and procedures, focusing on their lived experiences during clinical practice.
To gain a deeper understanding of these lived experiences, the study utilized a phenomenological qualitative research design. This approach focuses on capturing the essence of human experiences as perceived by those who have directly encountered them. To obtain rich and meaningful data, in depth interviews were conducted, offering a conversational and flexible space for participants to openly share their experiences. Unlike structured surveys, this method allowed for a more nuanced exploration of emotions, personal meanings, and real clinical situations that arise in the context of nursing care.
The study involves 8 registered nurses in hospital settings in the Philippines, selected through purposive sampling. These nurses had at least 1 year of clinical experience and were directly involved in patient care. Administrative staff and those unwilling to participate were excluded to ensure relevance and depth of experience. We chose this group because hospital nurses are frontline providers who frequently encounter patient noncompliance during daily care activities.
To guide data collection, we used a semi-structured interview guide consisting of demographic profiling, an overarching question, and follow-up probe questions.
Now, moving from method to meaning, and this is where the lived experiences of nurses begin to take shape. From the narratives gathered, 5 major themes emerge, each revealing a different dimension of patient noncompliance in hospital care. First, we have theme number 1, Beyond the Bedside Socioeconomic and Environmental Barriers to Compliance. This theme is reflected through the following subthemes: 1A, Economic Hindrances to Treatment Continuity, 1B, Geographical and Accessibility Barriers. Here, nurses described how financial constraints and accessibility issues prevent patients from continuing treatment. Patients may want to recover, but economic limitations, cost of medications, and distance from healthcare facilities often make compliance difficult or even impossible. In some cases, lack of transportation and limited support systems further worsen the situation. This shows that non-compliance is not always a matter of choice, but often a result of external circumstances beyond the patient's control.
In summary, patient noncompliance is a multifaceted phenomenon influenced by socio-economic, cultural, communicational, emotional, and systemic factors. It is not merely a matter of refusal, but a reflection of complex lived realities shaped by individual circumstances and challenges. Understanding this perspective highlights the importance of looking beyond surface behaviors and recognizing the deeper reasons behind patients' actions. Therefore, improving compliance requires a holistic and patient-centered approach, one that integrates empathy, effective communication, and culturally sensitive care, supported by both responsive nursing strategies and strong, well-coordinated healthcare systems.
Moving forward, lost in translation, gaps in understanding and communication. This theme emerges from the following sub-themes: 3A, communication-related obstacles to patient compliance, and 3B, cognitive and sensory hurdles. Patients often struggle to fully understand medical explanations, even when instructions are repeated. Some tend to rely more on physicians than nurses, which may delay compliance or create gaps in understanding. Additionally, cognitive and sensory limitations, especially among elderly patients, further affect comprehension. Difference in language and health literacy also contribute to misunderstanding. This shows that communication is not just about giving instructions, but ensuring that patients truly understand and are able to apply them.
Now we shift to the nurses themselves. This theme is called the test of patience, emotional and professional challenges among nurses. This theme is reflected through the following sub-themes: for A being emotional strain and frustration, for B maintaining professionalism, and for C influence and communication and delivery of care. Repeated noncompliance often leads to emotional strain, frustration, and fatigue as nurses continuously provide care and patient education. Despite these challenges, nurses remain committed to maintaining professionalism, respecting patient autonomy, and delivering quality of care. They demonstrate patience and adaptability in difficult situations. At the same time, nurses adjust their communication strategies, simplifying explanations, repeating instructions, and using different approaches to improve patient understanding and cooperation. This reflects the emotional resilience and dedication required in the nursing practice.
Finally, we come to bridging the gap, strategies and system support in managing non-compliance. The sub-themes under this category include 5A, patient education and repetition, 5B, follow-up and monitoring, 5C, legal and institutional safeguards, 5D, utilization of system support. Nurses respond to non-compliance by using patient education, repetition of instructions, follow-ups, and proper documentation. They also collaborate with other healthcare professionals to ensure continuity of care. In addition, nurses rely on institutional support such as financial assistance programs and hospital policies to help patients adhere to treatment. Importantly, this shows that addressing noncompliance is not solely the responsibility of nurses, but also a shared effort that requires both individual initiative and strong healthcare system support.
Next, we shift inward to between beliefs and reality. Cultural, personal, and perceptual influences. The sub-themes under this category include 2A, cultural and religious beliefs, 2B, personal health perceptions, and 2C, age-related decision preferences. Nurses observe that patients' cultural beliefs, religious practices, personal perceptions of illness, and age-related preferences strongly influence their willingness to comply. Some patients prioritize traditional practices or faith-based healing, while others believe they are already well enough or choose comfort over aggressive treatment. Age and life experiences also shape how patients view healthcare decisions. This highlights that health behaviors are deeply personal, shaped by values, beliefs, and individual perspectives.
For recommendations, hospital administrators may consider strengthening policies on medication access, discharge planning, communication, and patient support systems to enhance continuity of care. Healthcare professionals may provide more culturally sensitive and individualized care that responds to each patient's unique context and lived experience. Nursing students may develop empathy, communication skills, and critical thinking as essential tools in delivering holistic and patient-centered care. Lastly, future researchers may explore broader populations and pursue intervention-based studies to deepen understanding and improve evidence-based nursing practice.
You may scan the QR code as seen in our poster to see our references. So to bring everything together, this study reminds us that healthcare extends far beyond treatments and procedures. It is grounded in empathy, meaningful communication, and a system that recognizes patient behavior as part of a broader human experience. It challenges to see patients not just as cases, but as individuals shaped by unique circumstances and realities. As we conclude this presentation, may we carry forward not only the knowledge we have gained, but also a deeper sense of compassion in the care we provide. Let us continue to reflect on not just what we do, but how and why we do it. Because in the end, it is the understanding that truly makes a difference. Thank you for your time and thoughtful listening.